Hi, I'm Rishi Desai, and today on Raise the Line, I'm honored to be joined by U.S. Representative Donna Shalala, whose district includes part of Miami and the surrounding area. Congresswoman Shalala brings a unique perspective to the COVID-19 crisis, given her tenure as the longest-serving Secretary of Health and Human Services in U.S. history, not to mention other roles in government, and serving as president of the University of Miami and president of the Clinton Foundation, among other leadership roles. In Congress, she's known as a leading advocate for civil rights, increasing access to health care, and trying to get better education in a clean and sustainable environment. Thanks so much, Donna, for being with us here today. And Donna, your background obviously is remarkably relevant here. You know, we're talking about civil unrest, healthcare issues, unemployment. So I'm really excited to kind of get right into this. I'll start out by asking you, we've seen widespread protests in response to the murder of George Floyd and the systemic racial injustice that led to it. Many people right now don't trust the federal government to look out for their interests. You've worked across different branches of the federal government, so you have kind of the perspective of a citizen as well as a lawmaker. I'm really curious to get your take on the current situation.
Well, in some ways it's very exciting. I was out with protesters. They were, for the most part, young. It was very much represented Miami. It was Hispanics, it was white kids, it was college students, it was high school students, it was their parents standing with members of the African American community. And the message was very clear. Our police are not taking care of us, that they're in fact breaking the law, and there's no accountability in the system. And there are too many examples of police killings around this country, particularly of young Black men and children. There was a case of a 12-year-old in Cleveland who was shot by a police officer that had been fired from another department. So it's very clear that we need fundamental reform of the justice system, but more importantly, we need to understand racism and work on it in every part of our society, including ourselves. That this has gone on for too long, since the end of the Civil War, and it's unacceptable for a country that prides itself on its diversity to ignore the needs and the challenges that one part of our society experiences.
I'm really curious. There have been a number of young Black men, and as you said, kids as well. And when you said that, I got chills, that have died in recent years. And for some reason, right now, feels different to me. And maybe it's just the magnitude of the protests and the fact that there's an international piece now. I'm curious, do you feel that as well? And if you do, why do you think that is?
Because we saw it. The whole world saw it. Saw that police officer with his foot on that man's, on his neck. We actually saw it and saw the death of George Floyd. And that had an impact on every single one of us. But it also reminded us what had been going on in this country, what we had been protesting about, and that the police departments across this country had to look at themselves, and all of us had to look at them and say, we want fundamental change. We do not want bullies in our police department. We want people that understand what their roles are and their public service roles as well, and that their rules and they cannot get away with anything. And I think that we have said that very clearly with these protests.
There's so much focus right now on law enforcement as a public institution, a societal institution. You just kind of correctly brought up that we need to root out racism and its causes from all institutions. In terms of healthcare, we know that obviously there's a lot of bias in healthcare as well. Race affects health outcomes. It's very well documented now. Maternal health, how much pain medication you get. I'm just curious, can you talk about any work that you're aware of that's helping to reduce systemic racial bias in healthcare specifically?
Well, we've been working on disparities in healthcare for a very long time, and we know that disparities are different for different ethnic groups, for example. So the healthcare system, particularly at the federal role, has been working on these disparity issues. They have made some impact, but not significant impact. And when when COVID-19 hit, we saw the flaws in our system, and it wasn't just coverage. It was access to coverage, obviously, but it was more fundamental to that because it wasn't just related to poverty. Middle class minorities were not getting the level of care that they needed to get. This was hitting older people in nursing homes, but it also was disproportionately hitting minorities. Now, we've known for a long time that things like maternal mortality hits Black women in higher percentages than it does white women. So we've had these disparities, and what COVID-19 did was remind us the disparities in the healthcare system, but it also reminded us about the disparities in the education system at the same time. We did pass out more than 100,000 laptops to kids in our community, in my district here in Miami, the school board. 75% of the kids that go to the public schools in my district are at the poverty level or below the poverty level. So we're distributing meals to those kids, meals that they're missing because they're not in school. Their parents don't have the systems, the IT systems that middle class families had. So we've had to upgrade, make sure that they had access to the internet if they were going to do their classes. We lost a lot of kids. We don't know where they are in the process. And these were low-income minority kids that the teachers are missing from their classes, and we're trying to track them down. We don't know whether they moved to another place or whether they just didn't have access in their homes. And so we've gone knocking on doors to try to track down 4 or 5% of the kids that aren't showing up for these tele-classes. So in education, in healthcare, in job opportunities, everybody's talking about the fact that we're going to shift over because we've learned a lot about our ability to work with Zoom and with other things and to do our business. That's not true for poor people. They work in the restaurants in Miami. They clean the buildings. They're not going to be able to do teleworking. They're more at risk than anyone else for COVID-19 because they have to be out. They work in the grocery stores. They work in the drugstores. And when people talk to me about, well, work is going to change, not for them. And that's why our investments in unemployment and in small business has been so important. But we have to remember that, and we haven't focused testing on the population that has to go to work. There are huge gaps, and they're not just healthcare, and they're not just education. They're for working folks in this country. Because they're going to have to do, as work is changing, their work is not changing, and their incomes are going down.
Yeah, I mean, you're describing a perfect storm where incomes are going down. If their kids aren't going to school, they're hard to track down, and there's limited relief, it feels like, for folks in that income bracket.
I just got off the line on a huge discussion with a number of leaders of Congress on hunger in America, and the feeding programs, and the fact that we're plowing under certain kinds of foods because we don't have the distribution system. People in long lines in every community to get free food. Undocumented people that aren't eligible for SNAP benefits. I mean, we have big problems in this country, and they are made worse by COVID-19 and by racism, and we need to get our arms around them. This is not Donald Trump's strength.
Well, you brought up the next point I wanted to ask you about is the hyper-partisanship, right? So it feels like in the last 4 years or even the last 20 years in my adult lifetime, there hasn't been really a time quite like this one. And you always feel like this moment is the busiest maybe, but this feels extremely busy. And what's frustrating about it is the feeling of hyper-partisanship in the federal level. What is your sense on any sort of glimmer of optimism? So I know the list of things to be down on is quite long. Point me to something that gives you hope when you wake up in the morning, given all the things that you've seen and done.
First of all, the first three bills that we passed, the CARES bills, the initial bills were bipartisan, overwhelming votes. And now suddenly, when we need to get another tranche of money out, the president and the Republicans in the Senate have said, wait a minute. Maybe we spent enough money. Look, employment's coming back. Those numbers are fuzzy. Employment is coming back because we invested in small businesses, but we didn't invest enough in those businesses. We're going to have to do a lot more because there are a lot of people that aren't going to be able to get back to work. We need to extend that unemployment. We need to give money to state and local governments or they're going to start laying people off. Can we afford to have teachers laid off or police officers or fire officials or other municipal officials, the sanitation workers? No, of course we can't. So we need to give money to state and local governments fairly quickly. That was in our HEROES bill. And there's no movement over at the Senate. But the first bills were bipartisan. But we still believe that there is a crisis here and that we need to invest more resources in this crisis. And a payroll tax doesn't do it. The people that I represent are not helped, particularly by a payroll tax.
Donna, what are some things you've seen then at the state level or the local level, solutions at that level that you think are creative and are effective that you just wish more communities knew about so they could implement as well?
I think we did a heck of a job trying to get food to kids and to seniors. We put a simple telephone number in place for seniors, 311. Call 311 in Miami. They'll hook you up with Meals on Wheels and anything else you need. For example, if you're homebound, you need to get tested for COVID-19, we'll send a fire official, a fireman over to, or a firewoman over to test you. If you need meals, we'll deliver meals. If you're over 60, we'll deliver meals. We're not asking your income. We're just asking where you live to deliver meals. We also have been very responsive on testing for people that don't have cars, that can't do a drive-through, and in which we don't have a lot of public transportation in Miami. And what we have has been cut way back because of COVID-19. So we have walk-in clinics in the community, in the federally qualified community centers for people to walk in. But we haven't sent a consistent message that says, if you're going to work, you better get tested. And if you're staying at work, you better get tested. Our testing sites all had different messages. You have to be over 18, you have to have symptoms, and now we're at the point where we can actually test people that are going to work, and we need to do that. We haven't focused our resources on the nursing homes, where that's where the deaths are in our communities. And they've always had problems with infections.
Yeah, I was wondering about that. And that's kind of one of these blind spots for the average person that may not know that, but now, of course, is in the news and people become more aware of it. I'm curious, given that you've been so involved in the U.S. healthcare system, you've taught classes on the U.S. healthcare system, what are some common misconceptions people have about the way things work? I'm just would love to get your thoughts on gaps in knowledge.
Well, it's a highly fragmented system. It's very fragmented, and different parts of the population are covered in different ways. It's so fragmented that you have big gaps in the system. So if you live in Florida and you're a low income worker, you can't get government health insurance because Florida hasn't expanded Medicaid. Now, why did Obamacare put in Medicaid as opposed to the exchanges? Because it was cheaper. They were trying to keep within a budget, and that was fair. The cost of prescription drugs. It's not only that you could buy them cheaper in Canada, it's really that we've refused to step forward and negotiate as a nation with the drug companies to drive down the costs. And we actually introduced a bill in January, which I was one of the lead sponsors on, to say the Secretary of HHS ought to negotiate directly with the companies. The third thing I think we're confused about is that we've sent our supply chains for drugs abroad. And with a single exception of the flu shots, where in the 1990s, we were talking about flu pandemics. And I was so nervous about it that we moved the entire production of flu vaccine to the United States. It's the only one we really produce here in this country. We're totally dependent on China, on India, on other places to produce the next vaccine, but more importantly, to produce the drugs that we need to save people's lives. And we're going to have to think that through. I believe we've got to have a 3 to 6 month supply, which means we've got to have companies here that actually produce some of that supply without depending on the supply chain. But we've known for a long time that our healthcare system is highly fragmented. Now, I am not a Medicare for all person. I keep saying to people, imagine Medicare for all, a single payer system with Donald Trump as president. Oh my God. Who wants to deal with that? And by the way, England, and I'm a good friend of Simon Stevens, who runs the British healthcare system, is struggling with the same issues we're struggling with in terms of the quality of care, depending on where you live. And, they certainly have brought up the bottom, but they've got a problem with their senior population dying in their own facilities. They've got a problem with disparities for minorities in terms of access to the healthcare system.
Yeah, no, I think parts of what you're saying resonate highly. I was born in the UK, so I know the NHS from that world. And I think that, if anything, one thing that has become very clear is that some solutions that were posed, let's say even 5 years ago or 10 years ago, are being discussed more vigorously because of what you just said, that fragmentation. And the other issue, the earlier point around, universal basic income framed differently as, a bailout for small business owners. I think these things are discussed so much more today because we see these issues are global issues or certainly affect all swaths of America.
And I've become a critic of what we did for income supports. That is, we did the unemployment situation. It's uneven across the country in terms of states being able to deliver that. Our assumption always has been use existing platforms to get the money out fast. It turned out that the existing platforms, the Small Business Administration, unemployment, they couldn't get the money out fast. Would it have been easier to do what the Europeans did, that is, go to the IRS, tell them to take the first quarter of payroll and send a check to all those businesses? The answer is probably yes. But no one really was thinking that through. They've never dealt at this scale. When you're trying to scale up, you better make sure your infrastructure is ready for this.
It's a really good point. I think that's a key thing, and I think people think of infrastructure, frankly, as a boring topic, but it's not boring the moment it breaks down. And we see the effects of broken healthcare system in the sense of, like, you can't get testing done. All of a sudden, that's not boring anymore. Or the moment the freeway breaks down and you can't actually get from point A to point B, that's everyone's focus. So I think that's a really valid point. I like that you brought that up.
Public health system. Look at the public health system in this country. We've defunded it over the years. I remember going before Congress and testifying on our public health infrastructure. Their eyes glazed over.
Exactly. I
kept arguing, to handle all these infectious disease and these outbreaks, we have to make investments in state and local systems, in laboratories across the country. And everybody's eyes glazed over. The only time I ever got money for it is when I went to the Defense Department and argued bioterrorism. And then people got sensitive and were willing to put some money into the system.
Yeah, I mean, it captures the imagination. I think if you can't capture someone's imagination, you're not going to get them to care about what you're interested in. And
But now we're in a different situation. Now we've got to be ready. Now we have to build a system, a readiness system all across the country. We have to use academic labs. We had labs across the country that all we needed to do was certify them.
yeah, CLIA certification. Yeah, absolutely. So Donna, this is a great segue for my final question, which is, we have a whole cohort of students that are rising up, that are entering the medical profession and public health profession. This is what they're seeing for the first time. You've seen, I won't say you've seen it all, but you've seen a lot. And I'd love for you to give some advice to folks that are coming up right now in terms of how to put the current situation into perspective and what they can do right now to be more and more prepared for kind of the new tomorrow.
Yeah, you have to read a lot. I always recommend that people get on the Henry Kaiser Foundation, Family Foundation website, so they can get those newsletters that kind of summarize all the articles around the country, or the Commonwealth Fund that also has a set of things. You just have to sort of keep up. But the best way to understand healthcare and the best way to be a world-class physician is to understand people's lives. Look, I'm not a doctor, but everyone that provides me with a service, I can tell you exactly what their healthcare situation is, what kind of insurance they have. I used to walk into these big hotels in which I was giving a speech before 1,000 people that are experts in healthcare at a dinner meeting. And the first thing I'd say when I got up is, do you know what kind of insurance your waiter has? Because I had asked.
Wow.
You don't understand people's lives, you can't do healthcare. You certainly can't do healthcare policy, but you've got to understand their lives, not simply their ethnicity, their cultural background. You have to actually understand their history with the healthcare system. And that involves asking people questions. It's not so private to ask someone what kind of insurance they have. I've had waiters that kept me standing for 10 minutes while they described how their union had changed their healthcare system over time and what the difference was in their copays. But it gives you a feel for the system that you wouldn't have otherwise, because you've got to put a face on it. So as much of a policy wonk as I am and a data nerd, the difference between me and others is I actually know a lot about people. Look, I've been on the board of major healthcare systems. I was on the board of United Healthcare. I see it from the corporate end. I've run hospitals. I've delivered healthcare systems. I've been at the federal level. So I've been at every level. I've had thousands of doctors and nurses that have worked for me, and other healthcare professionals. I've run big schools of nursing and medicine. But what I've learned most, and what I've told my students, is you've got to understand people's lives. And if you don't do that, you can't understand what's going on in our country. You just have to ask your uncles and aunts, for heaven's sakes.
That's
all
fantastic
my
advice.
And aunts have different kinds of, my cousins, they all are in different kinds of systems.
That's really good advice, and I would imagine that people just don't get that question, and probably when they do get it, it feels good to get that question, that someone cares.
I remember my manicurist explaining to me before we did Obamacare that she could get her kids into kid care, and so they were covered. But she made too much money to be in Medicare herself, so she took care of her kids, and she took a risk. But once Obamacare came by, she got deep discounts. And so she was paying about $50 a month, and she was so proud. I remember my mother's home care people, because I never have anyone work for me that doesn't have health care. Either I pay them so that they can get on their spouse's plan, whatever that extra money is, or I pay for it directly. All my mother's home care workers were not provided health care by their employer. So I got them all on Obamacare, and I paid the difference between what they had to pay and what the difference was. It was the first time in their lives, they had been working in home care for 20 years, that they had a physical exam. What a difference that made for them.
That's remarkable.
Right, they had in being able to have health insurance. And all of them had their kids on the CHIP program, which I helped to develop, the Children's Health Insurance Program. Their kids were covered either on Medicaid or on the CHIP program, but they themselves didn't have coverage. But what a difference it made in their lives.
I didn't know your involvement on the CHIP program. As a pediatrician, I've seen many, many kids that have taken advantage of the CHIP program, and it's been a world of difference for them. So thank you for that. I didn't know that.
Military care collapsed on us when we weren't able to get universal health care in the 90s. We pivoted quickly, working with Senator Hatch and Senator Kennedy, and developed the Kid Care program. Now, that was for working class kids. It was our intention, if Al Gore got elected, to take care of their parents. That's what Obamacare did. Obamacare basically is for working class families. It needs to go deeper into the middle class because so many families don't have access to insurance because they're not, as we found out in the unemployment system, they're not, they don't get insurance through their employer because they're in the gig economy or something else. So Obamacare, we will build on that Obamacare platform, depending on what happens in November. That's too long of an answer for.
No, it's good, and it's a bit of an important history lesson as well. I think people often forget that things build on other things, and so that's part of why I was so excited to have you here, because you've seen the continuity and the long vision on that. Donna, any final words for our audience before I let you go?
No, I think it's going to be the golden age of healthcare. I think we're about to go into a dramatic change in American healthcare, not just because we're going to cover everybody, but I think we're going to move a little from our focus on, we're going to focus again on low tech, because we've learned that going back to washing your hands makes a difference. And if you look at how we've extended people's lives in this country, it's actually been through building codes, through sanitation, through immunizations. That's had a bigger impact than all the high-tech stuff. And I am totally supportive of high-tech and great science and all of that. But we've now taught a generation that washing your hands makes a difference, that wearing a mask, that social distancing, that the fundamentals of public health. And everybody has to integrate that into their practice in the future.
That's a great parting lesson. I would add nutrition to that, which I know you care deeply about as well. But thank you so much. I think
not smoking, by the way.
And there's a long list of nots, exactly.
Not smoking anything.
That's a good way of putting it. Donna, thank you so much for taking time to do this with me. It means a lot to me and to our listeners. I appreciate it.
My pleasure.
Thank you very much, Representative Shalala, for being with us today. I'm Rishi Desai. Thanks for checking out today's show. Remember to do your part to flatten the curve and raise the line. We're all in this together.